Having great posture while pregnant is actually pretty difficult because you are holding up tremendous amounts of weight. Okay, so this weight, it's just heavy. I know, I'm there right now. I'm 8 months pregnant. So holding up this tremendous amount of weight for hours and hours all day just makes you tired. It takes tremendous amounts of back and core strength to support your body correctly. So a couple things we're going to go over is I want you to think about standing tall. Not military tall, but string through the back of your head tall. So I'm going to show you guys what this looks like. All right, so this is military tall, okay? We don't want this. We don't want to be using your shoulders to help have good posture. This is exaggerated. It's too much. It'll cause problems down the road. So what I want you to think about is simply string through the back of your head, not the front. So the back of your head, slightly tucking your chin just a little bit and pulling you up toward the ceiling, okay? We're not tucking our bottoms under. Okay, this is very, very important. We're not tucking our bottoms under. We're not hanging forward into our pelvis. All right, we're pulling on that string, which will slightly help you engage your core, and we'll pull you up nice and tall. Now, let's do some quick checks. So if you'll stand up with me, I want you to find your normal standing posture. Where does the weight normally balance on your feet? Okay, so think shift into your toes just a little bit on the balls of your feet. Is that how you normally stand? You normally kind of shift your weight forward and then hang. This is how I see most pregnant women standing, right? All right, they have that, oh my gosh, I'm so tired posture, which is horrible, okay? So if I hold the edges of my rectus abdominis muscle, so the muscle that runs up and down the front, all right, this is where that diastasis occurs. This is where that pooch belly happens. All right, so if I hold the edges of my diastasis and I hang into that posture, okay, and I hang into that posture, you can see it pulls apart my abs. So if all day I am hanging into that pregnant posture because, oh, I'm so tired, I'm taking what would normally be a supported core, holding and knitting my diastasis together, holding my abs together, and man, I am forcing pressure on that sucker out all day long. All right, our body can only take so much pressure before it's like, I give up, okay? We don't want to force it to that point. So what I'm going to need for you is I'm going to need you to think about shifting your weight backwards. Balancing your weight over your ankles. Thinking about balancing it between the balls of your feet and your heels. So you're going to find that nice balance point and you're going to tuck your chin, okay? This is going to bring you upright, right? It's going to keep you from this tucked bottom posture, hanging forward into your toes, collapsed chest, hanging open on that diastasis, all right? And if I shift my weight back, string through my head, look at how great. It pulls me up nice and tall. I look strong, I look capable, I look like, wow, I could actually move during this pregnancy, which I can, okay? So this also really helps prevent nagging back pain. So if you're getting back pain when you stand and it's just nagging across, really pull that belly backwards, and that is going to help tremendously with unloading your spine and where it connects to your pelvis and helping to support this area so you feel great. The other reason that you really want to shift your weight backwards and tuck your chin is your pelvic floor. All right, so if you tend to hang forward into your hips, this increases the pressure down on your pelvic floor. Now you already have a lot of extra weight pushing down on your pelvic floor, and you have tremendous amounts of ligament laxity getting you ready to have that baby, affecting your pelvic floor. So if you shift forward, tucking your bottom under like that, all that's going to do is create more force and pressure down and out on the pelvic floor that's going to cause pelvic floor dysfunction postpartum. And you might even be experiencing some of that now. You might even be experiencing the occasional leak, all right, or the occasional like sneeze pee. Oh, I need to run to the bathroom. Those are not normal, and those are not things we want to experience, all right, even on multiple pregnancies. Okay, so just a quick review. Okay, stand with your feet straight and then shift your weight back for me. All right, you're just thinking about bringing your bottom backwards, bringing this belly backwards a little bit, string through the back of your head, pulling yourself up nice and tall. This posture should feel great, should feel relief on your back. You're not trying to come up taller, okay? You're not trying to come up taller because that's gonna hurt and strain your back. You're tucking that chin, shifting your weight back, supporting your belly. This is the posture I need you to have 100% of the time. Yeah, that's a really, really hard thing to do. But you know what? It takes muscle, it takes strength, and it takes remembering, but you're gonna feel fabulous. Now, we have stairs in our house. I tend to notice I can stand with this great posture without really thinking about it too much at the park or doing things around the house. But as soon as I go to walk or step up the stairs, that takes that extra effort, right? I'm carrying an extra 25 pounds now. So that takes way more demand on my body, and my body wants to say, oh, this is so hard to walk up the stairs. Bottom wants to tuck under, head wants to come forward. So what I really catch myself is on the stairs, tuck that chin, okay? That's all you gotta do. So when you think, I'm gonna walk upstairs, I'm gonna go walk across the street, I'm gonna do anything that involves moving with this pregnant body of mine, you are going to think, tuck your chin to realign your posture and connect your core. Just that simple act of tucking your chin will connect your core. Okay? It's gonna help you come back with a great looking abs postpartum. It's gonna help prevent back pain, turn on that deep inner core system, prevent pelvic floor issues, you name it, you're gonna feel great. So there's one thing you take away from today: shift your weight back, tuck your chin, and put that into everyday life.